types of endocarditis. We have acute endocarditis or we have subacute endocarditis. Okay? Acute endocarditis usually occurs on native valve, okay, usually occurs on native valve, normal valve, okay. So usually occurs in normal valve. Whenever the valve is normal, in that also we can have acute endocarditis, and this is usually caused by staphylococcus, usually caused by very virulent organisms like staphylococcus. So they are very virulent, so they have the power of attacking even the normal valve. So this staphylococcus causes endothelial injury, and this endothelial injury will start deposition of platelet and coagulation factor over which staph will deposit. Okay? So this is acute endocarditis, which is like immediately staphylococcus comes, causes injury, forms platelet and fibrin and deposits on it and starts growing. So this will start becoming a vegetation in acute endocarditis. Whereas the second type of endocarditis is subacute endocarditis. So subacute endocarditis usually occurs in previously damaged valve. Okay, so like let's say the patient has a history of rheumatic heart disease. So already the heart valve is previously damaged. So valves are lined by endocardium, right? So they are already damaged by rheumatic disease. Now already damaged valve is there, already platelet and fibrin is deposited on that. So they already have some verrucae on them. So they have some warty vegetations on them. So I told you earlier also. So these warty vegetations which are seen in rheumatic heart disease are nothing but immune complexes, platelet and fibrin, which are present in the rheumatic heart disease. So this is a foci, this is the grass. Now what happens, even non-virulent organism like present on the oral cavity, let's say the patient gets treatment for the dental caries or dental treatment. So due to that dental treatment when he's taking, so there is some injury during dental procedure. So these bacteria enter into the bloodstream, okay, through that dental procedure. So once they enter into the bloodstream during the dental procedure, now they when they're in our bloodstream, so they will find this foci very interesting, okay. So then they will go and lodge in these infective endocardiums, okay. So that is what is subacute endocarditis. So what is subacute endocarditis? So subacute endocarditis usually occurs whenever the heart valve is previously damaged, okay. Also it is caused by non-virulent organisms, usually those organisms which are usually present in the oral cavity like streptococcus viridians, okay, is a classical example in this case. Understood? So that is the difference between acute and subacute. So if you have to make a chart or a difference between acute and subacute, what will you write? So in the chart, acute and subacute, you should write acute endocarditis is sudden abrupt onset. Subacute endocarditis takes some time to start, okay. Acute endocarditis is caused by staph aureus usually, and subacute is usually caused by again streptococcus viridians, okay. Again you have to write that this is usually caused by skin bacteria. Usually subacute is caused by oral mucosa bacteria. Again the walls are usually normal in acute endocarditis, usually the damaged walls are there in subacute endocarditis, okay. Obviously they are rapid onset, symptoms are more severe. These are slow onset, insidious onset, and the symptoms appear insidiously. So that's the difference between acute and subacute, which everybody should be super clear with, right? Now we have another two types of, I hope you're clear with the pathogenesis. Yes, both acute and subacute. So once we are clear with the pathogenesis, so acute में तो bacteria ने खुद damage किया, subacute में there is already a damage due to some heart condition, right? Now once we are clear with these two type of endocarditis, now we should also be clear about two other type of endocarditis, which we say native valve endocarditis, and the second is prosthetic valve endocarditis. So what does this difference means? Native valve endocarditis means that there is a native valve, you have your own valve, and that is getting inflamed. So that is native valve endocarditis. Again, this native valve endocarditis could be acute, subacute, okay. So that's native valve. Prosthetic valve endocarditis means endocarditis which occurs in a valve which has been prosthetically put in a patient. So it depends when was this prosthetic valve put. So let's look at this valve first. Heart, okay. So obviously when it is put, it can cause inflammation of the endocardium. So this can either occur within 1-2 months of installation itself. In these cases, usually the highly virulent organism like staph aureus will itself go and cause endocarditis. But prosthetic valve endocarditis, if it is occurring after 1 year of adding prosthetic valve in the heart, then majority of the time the bacteria is not very virulent. It is usually streptococcus viridians. Although staph can also cause endocarditis after 1 year, but majority of the time it is streptococcal viridians which cause prosthetic valve endocarditis after 1 year. So before 1 year, that is within 1 to 2 months, it is staph aureus usually. So it's usually staph aureus or